Hello again, and this is Tiffany reporting from Bio International here in San Diego. And the last discussion, the last interview before I pack it up and go home, I have with me Jamie Reidy from DxTerity. Hey.
Hey, Tiffany. Thanks for having me.
Yeah, absolutely. I had the pleasure of meeting Jamie actually as a friend. Kathleen Arntzen, who's with Lupus Allied Diseases Association, introduced us the other night, and then found out about the great work that you are doing with DxTerity and in precision medicine, which is very important to our organization. So I just wanted you to tell everybody a little bit about what you're doing.
Sure. DxTerity recently launched our Elevate study in lupus. We're really excited about this. We're trying to explore uses for our type 1 interferon test. We call that IFN1. Basically, we are trying to help guide precision medicine in lupus. In oncology forever, they have very specific biomarkers and tests and not as many in the autoimmune space. And so we're trying to help remedy that in lupus. Type 1 interferon, IFN1, is one of the most stable biological pathways in lupus and one of the most well-studied and characterized. And so in the general population, most people don't overexpress IFN1. But in lupus, more than 50% of patients overexpress IFN1. And so what does that mean?
I was just going to ask.
Not great, Bob, unfortunately. Patients who overexpress IFN1, or what we would say IFN1 high, are more likely to have more severe disease. They're 3 times as likely to progress to lupus nephritis. And female patients who are IFN1 high are more likely to suffer preeclampsia or difficulties during pregnancy. Now, that all sounds very scary. There is some recent positive news, however, that the FDA approved a drug called Safnello, which is an IFN1 blocking drug. So patients who are IFN1 might be good candidates for Safnello. So it's nice to have some hope, handy. And so we are launching Elevate to help, explore further uses of our test. And it's really easy. You sign up on an app. There's 4 finger stick blood collections, 1 per quarter over the course of a year. Another area that we're really interested in is in flare capture. Flares can just knock out a lupus patient, and it's very tough to assess biomarkers during a flare because a patient would have to be really in the clinic and while the flare hits, in order to give the test. But our test is done at home. So we just drop ship the fingerstick collection kits to a patient's home. And so we will send 4, 1 for each quarter, and then we'll send a 5th so a patient can have it in case she feels a flare coming on. And most experienced lupus patients can tell when a flare is coming on. And so we're hoping that we can capture that and look at various biomarkers that are in our modular immune profile test. Not only do we look at the IFN1 score, but we look at B cells and T cells and plasmablasts. And so we're hoping that we can see, one of these biomarkers is just going through the roof ahead of a flare. And maybe that will help guide therapies and treatments, down the line. Another thing we're hoping is that we're trying to give rheumatologists another tool, right? If a rheumatologist knows that her patient is IFN1 high, well, maybe they treat her a little differently. Maybe they change therapies earlier because they know that the patient's more likely to have more severe disease. So we're trying to, like we said earlier, trying to bring precision medicine to lupus, and the Elevate study is, we're enrolling now, and we're hoping that we can make that happen.
Okay. So just a little reminder and background for those who may not have heard other versions of the show or other segments, but our organization, AiArthritis, very invested in precision medicine, which, as Jamie said, testing those biomarkers, testing those parts, those components of your own individual signature, if you will, that could not only often predict or help with diagnosis. And in this case, it's the precision medicine really using also if a treatment could be best, because we all know how many times we try and fail something, and then what happens? We have uncontrolled inflammation. That's what leads to comorbidities. And in particular, in diseases like lupus, comorbidities are potentially even more common than, let's say, in rheumatoid arthritis or some of the others with organ involvement as well. And as you said, lupus nephritis. So that is why AiArthritis has been so invested for the last 7 years in this type of science, because we know that the individual and having access to the right treatment at the right time matters. So I wanted you I know you got to run off here, but I'm going to ask you first, can you explain where this is sort of in the research project or in the research process? So this isn't something people can go out to tomorrow and in the clinic and ask the rheumatologist for, right? So where in the process it is, and then how they can get involved if they're interested.
No, so patients can enroll right now. And the website is theelevatestudy.com. And it's all from home. It's remote. As we discussed, lupus patients have enough going on, right? They don't need to schlep. We don't want them to have to schlep into the clinic for yet another needle blood draw. This is something can be an active participant from home, and then they just drop it in the mail. We're trying to make it as easy as possible. So, they don't have to change medications. We hope that they do let their rheumatologists know that they are enrolled in Elevate, because then possibly their rheumatologist can order a prescription or write a prescription for the test, and then they will get the results. So we're really just trying to build up data to show that precision medicine can come to lupus.
Okay, so that is where I wanted to go with that, and make sure that everyone knows this is where we are in this community with precision medicine. Cancer has come before us, and there is a lot of data that's showing, okay, this test might help us to predict. And so this is along those same lines. With cancer, there are current barriers in getting those types of things into the clinical setting. So your participation at this earlier stage, it not only can help prove the data that's necessary to get access to all other patients, but you could be on the forefront in also communicating with your rheumatologist, letting them know that this is a potential and out there. And then in the greater scheme of all of it, you could know if something could possibly work better for you and could help us move the needle forward into the clinical space, right?
Yes, that's a great synopsis, and we hope that all ends up resulting from this.
All right. So, well, thank you so much, Jamie, for taking a few minutes out to talk to us, and we'll be following up and letting you know the response that we get from people who are listening to this.
Thanks, Tiffany. Thanks for letting me talk about Elevate and DxTerity. We appreciate it.
All right. Wonderful. Thank you.